Good afternoon, everybody. Good evening. I'm glad you're all awake or not, but wake up. The next 20 minutes might be the most important session you've ever heard in your life. It might save your life. There will be tidbits in there which will echo after this session is over. I promise you that. I'm a lung and critical care doctor, the kind of doctor you never want to meet. You have to be really sick to come to see me. And today's session really is about, now, my friend and mentor, who I use 24/7, ChatGPT 4.0, did not design the title, but I kind of came up with this title of Future of Health and Healing, and I'm an optimist, and my confessions are that I see a lot of opportunity among the people sitting in this room because you're running everything in the world. At the end of your keyboard is often a patient. At the end of the line of code that you write is somebody's life at stake. So I think it's important for us to recognize that the jobs you do, even though it might be nasscom and software, is critical to all our lives. And we are all patients, one day or the other. We all know patients, and most of our families have healthcare issues. Great, thank you. So I think I wanted to really touch base today a little bit about what's coming down the line, what's available today, and kind of get a little sense of where health is headed, not just in India, but around the world. Most of you probably have neck pain from flexion, just doing that with your phones. For the next 15 minutes, sit up a little bit. I'm guilty of that. I was checking my WhatsApp continuously, but talks were excellent. The last session was truly moving. The last two sessions which I attended, I loved the terminology of servant leadership, and I really loved the fact that health should be a right. Those are the kinds of takeaways that I got. And I think those are the kinds of decisions that will help us with the future of health and healing. The year is 2070. Imagine a world where patients anywhere are being monitored with a central command center. Emergencies are picked up several hours before they actually happen, and prevention is the key in that world. What if we could have machines that talk to us? What if they listen to us as we go about our medical lives? What if they are guiding us, nudging us, and cheering us on? Is this possible? Is this the future? By a show of hands, how many of you think that this could happen in 2070? Well, good for you. It's happening today in 2025. I am actually in a hospital system where I'm doing this every day, where I can actually see patients who are possibly several thousands of kilometers away, and I can actually make out that there are people who need healthcare assistance who are anywhere in the world. And my friend Sora made that image on the right, and you can see that the number of patients we need to see is not going to go down. The number of physicians and health providers is, of course, going to be limited, and technology is essential for health and healing in the future. There's a number I put in there, 28. It's not an eye test. How many of you know what that means? Shout it out. Well, that's India's median age. India's median age is 28. There's only 75 million people above 60. In about 8 years, that number is going to be 150 million. So there's about 1.4 billion Indians getting old in the next 20, 30 years. Have you planned for that? Have you actually thought about the healthcare needs of that society? And do we know how fast healthcare moves? Are we doing things to actually make a change there? So the future of health and healing needs to account for these numbers. And these numbers are even more stark if you look at the rest of the world. The WHO has said that there's about 4.5 billion people in the world who do not have basic care. There's about 1.6 billion people who have disabilities. And the health span, lifespan gap is about 10 years, even in the United States. So if you really look at the kind of challenges we have, we need to stop wasting our time. We really need to figure out how do we solve these problems. If this works, let's see. So I do remote critical care for the United States from India. And based on that model, we built something for India. So we were obviously very busy during COVID. We had patients all over the country on ventilators who had never had patients on ventilators. And we were actually able to guide them and teach them how to use a ventilator, how to change the settings, how to manage patients who really had respiratory failure. And I could do this sitting somewhere. Now, technology has evolved, but really hasn't kept pace with the needs. There are probably an amazing number of ways that these things could be simplified where you don't need humans. In fact, we need those kinds of technologies where a human physician is probably not required. And that, I think, is the future. I have personally used ChatGPT, for example, to diagnose patients where I did not know what was going on. It looked like something, but it wasn't exactly that. And it actually gave me a differential which was correct. So I have actually had really good luck with augmented intelligence, and I believe that is the way of the future, where you're going to walk around hospital walls within the hospital, you're going to walk at home, and the future hospital is something without walls. Data travels with you. Now, critical care, for example, can be anywhere. It can be at home, it can be on the road, it can pretty much be anywhere that a patient is. So I believe health systems need to evolve to manage the patient wherever they are. Well, this is an example of another physician who's actually reviewing an echocardiogram of a patient situated about 500 kilometers away. As long as the images come in, you can interpret. So most of healthcare actually is cognitive. Most of healthcare is actually thinking. And you can do a lot of stuff with the thinking part. And the next steps of technology, I believe, are going to be things which are going to be hardware related. So automatic systems to transport things with drones, automatic things which can move things within a hospital. In fact, even doing blood draws on your own. There are robots which help us operate even today. And there are robots of the future which will actually help manage patients. And there are multiple prototype examples of that where they help even move patients around in their homes. There's a system called fall detection, which we actually do for a bunch of locations in the US. And what that does is it uses a very cool technology of radar in the terahertz range and actually creates an image of the human being and is able to detect where they are within a particular room. And the AI over there has evolved to the point where it can even detect if they're having changes in their gait. It can even detect their vital signs using radar technology. And we've been able to detect falls with very high accuracy. We heard about 5G. I even heard about 10G today. I don't know how true that is, but I heard there's some 10G thing going on in China. But I think the 5G that we have heard we use in our ambulances can actually look at a patient in real time right from when they're picked up. And our command center physicians are able to actually, I would say, like really guide the pickup of the patient and guide them through their journey up to the hospital. As you know, most of us, some of us do, when you're the ambulance, you move to the side, but oftentimes there's no place to move to the side. So ambulances can get delayed even in Indian traffic. Our roads and our transit times are quite long because patients need to be sent from a remote site into a major city. And if you have guidance of that sort using technology, can really help. I kind of came up with this little table here. I don't know if you can see it, but there's a bunch of old problems. The old problems are sepsis, which is infection. NCDs are non-communicable diseases. Stroke, of course, is brain attack. And then, of course, trauma, which are accidents. There are multiple good solutions. For sepsis, for example, we have multiple AI-based solutions which look at the vital signs, they trend it. We, in fact, use that in our hospitals, where you can actually detect several hours before somebody gets sick. And sepsis essentially is where the body is trying to fight an infection, but unfortunately, it's in overdrive and is dropping the blood pressure instead of raising it up. And that is something that you can actually pick up much earlier than it happens. You have to find the source of the infection, and many older people die because of sepsis. There's about a 40% mortality rate despite the best of medicine. In NCDs, for example, you can detect glucose and manage it with a continuous glucose monitor. There are many versions of that. In stroke, not in India yet at scale, but in other countries, there are very good tele-stroke models. So when you have a stroke, essentially, it's a plumbing problem. You have a blood vessel that got a clot. It can be, if it's in the heart, it's a heart attack. If it's in the brain, it's a brain attack. And if you have a blockage, you can give a medicine to bust the clot, and within it used to be 1 hour, then it became 3 hours. Now they're saying even up to 24 hours after a stroke, in certain situations, you can dissolve the clot or put a little catheter in to extract the clot and save lives. The problem is, say this happens in a situation of a location, say 500 kilometers from here, where there isn't a neurologist. You have only a local MBBS doctor. You really can't do that at scale. What you do need then is a way to have a telemedicine setup where you have a neurologist looking in on the patient. There are plenty of CT scanners in India. So if you have the CT scan images transmitted into a central command site, very quickly you can do this. And I have done this for patients in the United States, sitting in India, where you've diagnosed a stroke and told them, go ahead and give the clot-busting drug. There's a system in Australia, in very limited other locations, where they have what's called a mobile stroke unit. So you actually have an ambulance with a CT scan inside it. And you can go to the site of the pickup of the patient, diagnose the CT image of a stroke, send the image to a central site, and they've shown that they can save about 37 minutes between the time of diagnosis and the time of treatment. And that's a giant number. 37 minutes to treat a stroke is amazing. So I think there are these solutions out there which are futuristic. They're available in today's world, but they're not everywhere. And the gaps that are there are quite, they're pretty big gaps. Trauma, how many of you wear your seatbelts? Not on your, not motorbikes, but on your car. You wear seatbelts, right? How many of you wear helmets? Anyone use bikes? Okay. How many of you put the chin strap on your helmet? Most people don't. If you look around, when you're on your way home today, you look at that, and that's useless. When you have a sudden brake, Newton's law, action, reaction, the thing flies off, and I've seen it happen. And there's no use of a helmet. So I think there's need for evolution in this space because you can't treat trauma well in India. It probably need a better way of preventing it. Now, there are some new solutions I call in search of problems, which means technology, whiz kids and smart people have come up with great ideas. Unfortunately, what I've seen in my practice is a lot of times very smart people have made amazing solutions without talking to a clinical team. And what happens then is there's no uptake. There's no implementation of what you've just invented. So I think it's very important we look at that. Ambient AI, you've all been using it to get your insights, use the AI to tell you what to do. But in India, doctors hardly write notes. One, of course, you can't read what they write. Mine too. My third grade teacher told me that my handwriting is bad, and that hasn't changed. So what I've really seen is that ambient AI in the United States is great. A study just came out in the New England Journal of Medicine Catalyst edition, which showed that there's about, I would say, 70 minutes a week that a doctor is saving because of just automatically, not even dictating, just talking and the machine picking it up. In India, most notes, except in tertiary care hospitals, are a name, a date, a bill, and the name of the medicine. There's oftentimes not even what you came in for. So really, there's not a need for an ambient AI solution in India for this model. However, in tertiary care, which is a large hospital setting, very useful. Take the example of your phones. How many of you have a new phone which is 2 years old? Some of you do. Good for you. But you really need a new phone every 2 years? I don't think so. So there's a lot of this stuff that comes up where we are really, I think, servants of technology without realizing the value for it. Have you all heard of something called a hologram? Have you ever been a part of a holographic conference? So they have this amazing, like Star Trek-y stuff, where you have a little big box. You can actually see a 3D image of the person. It's very cool. It's actually a great way to interact, to do a telemedicine consultation. But it's prohibitively expensive. It's amazing. I love the solution. I've tested it out. But then I can't really deploy it at scale. So I think there are some solutions which need to be lowered in terms of the cost. How many of you have heard of the gut microbiome? You've all heard of genetic medicine, genomics, right? Excellent stuff. We still need to figure out what to do with it. In rats, it works. Well, a little gruesome stuff here, but they've done fecal transplants in rats. Fat rat has a different gut microbiome, which is the bugs inside the gut of a rat, compared to a thin rat. If you move the bugs from the thin rat into the fat rat loses weight. People have been extrapolating to humans. Humans are not rats. There is some signal, though, that maybe it makes sense. So there are these kinds of evolving things which come up in healthcare, especially the future of health and healing is important. And this is a quotation that I love, which says, never stop learning because life never stops teaching. What really does save lives, though? In intensive care, you might not believe it, but it's nothing expensive. Fast Hug is an abbreviation we use as doctors in critical care to remind us that these are the checklist of things every patient needs. One of them is F starts for feeding. A is for analgesia, pain control. S is for sugar management. T is for preventing blood clots. H is for head of the bed elevation, and so on. The head of bed elevation is quite interesting. Essentially, if you're flat, stuff from your stomach goes into your lungs and causes infection. If you're upright a bit, you're not able to do that. They've actually tested with radioactive food to see where it goes. So these are very simple things which really save lives. There's a famous thing which says that preventing medical errors are probably the third cause of leading cause of death. There's a lot of controversy around that, how the data came out. But essentially, though, they are an important cause of death. Preventing medical errors is very important in healthcare. Avoiding hospitals is a good thing. Hospitals are full of bugs. And oftentimes, patients who stay longer are filled with bugs. Even though you might do the best hand washing, you might still not be able to prevent infections. So I think it's important that you try to treat yourself by not going to hospital, which means you don't fall sick, which also means you focus on wellness, which also means you focus on the good habits of sleeping early. How many of you sleep before 10 p.m.? Really? I mean, Indian time zone, not some other country's time zone. No, so, okay, so yeah, so I mean, that's great. If you do sleep, I mean, that's great, wonderful. It's good to sleep early. It's good to get adequate sleep. And in fact, sleep disorders are a big problem. Many of you snore, I know that, I do. And you can actually get a sleep study, and that will tell you if you have a risk for sleep apnea, which also has now been linked to multiple metabolic diseases. Everything I've told you is really not the future, it's actually here. It's just that it's not deployed at scale. I also believe that compassion saves lives. Holding the hand of a patient is often the only thing they remember when they're unconscious in an intensive care unit. Holding the hand of a family member and reassuring them, I think, is critical to healthcare. Looking into the eyes of a patient as you do an outpatient appointment rather than at your screen is also extremely important, because they've done studies which showed that if you allow a patient to talk for 90 seconds without interrupting, you know the history of what actually they came for and a diagnosis, and the patient also feels like they were heard. Like, very good data which shows that. So I think it's important that we listen, which is probably why we have 2 ears and 1 mouth, but I believe there's an epidemic of AI illiteracy. Everybody is talking AI, but they don't know what they're talking about at every scale of the industry. There's probably a few domain experts who know what they're talking about. How many of you know what MCP stands for? Not male, whatever, but the other MCP. You all know that? No? You do? Some of you do? Okay. Those who knew, great. Model, context, protocol, something. So essentially an LLM or LLM, so something of that sort. So there's words coming out every day. And my company, which is Apollo Hospitals, a division which I work for is called Apollo Health Access, is focused on doing things which are pretty cool, like AI as a service. We do virtual remote care for the world. We also have a large, well, a GCC conference. We do it for a US health system. And I believe the Kali Yuga really is an AI Yuga. And I put up an image down there of, well, my friend Sora made that one too. You can take a horse to water but can't make it drink. But the implication there is, despite having amazing solutions, amazing things, unless patients and providers adopt them and use them, there's no use. Healthcare, unfortunately, is still very analog. Think about your own senior, friendly family doctor. Do you think he's going to be using ambient AI and prescribing things using technology? Probably not. I might be wrong, I'm biased, but I think you need to figure out how do you reach them. Unless you reach them, the future of health and healing will remain analog despite all the advances we have. That is the internet speed of Starlink. I was on a flight several months ago, and I had really good connectivity. So good, the connectivity, that I had to actually join a work call. And I was the only one on video. And I actually had the best connectivity of everybody out there. This is better than my internet speed at home. And it was amazing. Starlink is really cool. I think it will transform how things are done. I recently heard that the country of Indonesia is trying to adopt Starlink because their breadth of their country is 8,000 plus islands or something, which is about 8,000 kilometers across from one side to the other. For them, distances are so much and so difficult to get between their islands. Unless they had this kind of connectivity, their healthcare will be impacted. So they're trying to adopt that at scale in order to do things with their technology. Another interesting thing they do, so innovation is not always about technology. Their health minister was talking, and he mentioned that there's something called population health management, which means if somebody has diabetes or hypertension, you need to train them to detect it, diagnose it, follow it, etc. So he's got about 50,000 community health workers. And he said, I want 1 million community health workers. And what did he do? He went and educated the mothers. He said, every mother knows how to take care of a fever, a diarrhea, and a belly pain in her kids. I'll teach her how to take care of diabetes and hypertension in her immediate family. So immediately you had 1 million mothers who knew how to measure blood pressure, how to measure a sugar, and 1 million people who could actually make a difference. So these are the kinds of innovations which we need to adopt along with technology. The gaps we have, of course, are tech gaps. There's a huge mental health gap. There's a huge need for us to recognize that mental health is a reality and how do we handle it. Access is, of course, an issue. I believe that can be solved with virtual care. Cost is a giant problem. I believe margins are important, but not margins so bad that you're not able to actually take care of your own patients. And of course, we need to focus on self-healing. I'm sure you've all heard of the adage that common cold will last a week with treatment and about 7 days if you don't treat it. So I think most illnesses, they come and go. You just need to make sure you wash your hands and cover your face like we did during COVID. And I think it's important that you transform the way you take care of yourself, which is our tagline for our hospital. As a physician, I've seen patients recover against all odds. As an optimist, I believe the best is yet to come. I think when biology meets bandwidth and empathy meets engineering, healing becomes exponential. ChatGPT, not me. But sounded good, so I said, let me just put it in there. I mean, there are other things I can say, which include the fact that health and healing are critical for all of us. And I think, I would tell you something that would save your lives, and you all stayed awake. Sorry, I will still tell you that. If somebody collapses, you need to do CPR at 100 times a minute, which means you hold your arms and braces on the lower part of your chest, the breastbone in the middle, and push down hard and fast 100 times a minute. The second thing, how many of you know the nearest AED, automated external defibrillator? Like in this room, anybody knows where the AED is? Nobody. Critical stuff. This stuff saves lives. I have personally saved lives, even within my hospital and outside the hospital. It's electricity to reshock the most common irregular heartbeat that happens after a heart attack. You've all heard about, Dr. Abdul Kalam passed away while talking. Hope that has happened. There's other people who have passed away suddenly, and these are not, honestly, you can save these lives, a lot of these lives, where you can actually, if you had the AED device to give electricity, you can actually save lives. So I would recommend all of you figure out a way to learn CPR, figure out a way to get an AED access wherever you're at. And I think the third big thing is get enough sleep. I think it's a very difficult thing for this audience. You guys are running the world, so it's not easy, but I think you still need to get enough sleep, me included. So I think one of the things I want to really leave you home with is, it's very rare that I actually get 4 minutes before I end, so I'm just going to keep talking. So I think it's very important for us to really recognize that the future is a technology world. The future is about giving care to people. And I think the future is also about recognizing that half the world does not have any of this. How are we going to get it to all of the world? How are we going to do it in our lifetimes? And how are we going to make it in a way that is compassionate as well as evidence-based? I'll leave you with that. And I think since we have a couple of minutes, if the organizers are okay with it, I'm okay with taking a couple of questions. Thank you.